maybe not so good news. The good news was that her health insurance policy was reinstated. Now, I don't know if the telephone calls at the U.S. Department of Labor filing a complaint about COBRA had anything to do with that or not. Not really sure, but her policy was reinstated.
Woo!
However, it's a new benefit here. So, she's probably looking at dropping out of physical therapy because she doesn't have the money for the co-pays to go to the physical therapist 3 times a week. So, that is part of the underinsured dilemma of multiple numbers of people in America. And then on the money side, come to find out, the temporary disability insurance company uses a third party to request medical records. That was the authorization that was faxed into them at the end of August, or within the first couple of days of September. It took over 3 weeks to find out that that particular form was not acceptable to the healthcare provider. So, a new form had to be sent. It was sent. I was in Beloit on Friday. My daughter calls me, says I need to get this faxed out. So I made the trip back, came back to Beloit to fax it, because in the medical industry, there's not a whole lot of stuff that's done by email yet, because the medical field is one of the few industries in the United States that is not up to speed on electronic record keeping. So the bottom line of that particular story is the fact that my daughter has been without any income, and this check probably won't come until the middle of October, without any income for six weeks, probably approaching 7 weeks before the check comes. Yet she has to be able to make the COBRA payment in order to be able to continue the health insurance that she can't use because she can't afford the copay. Does that make sense? But
yes and no.
That's healthcare. That's healthcare in America. That's the payment system that we have in America. And now I usually don't pick on people, because my comments about the healthcare system deal with the system. For the most part, there are great many people that are very dedicated to their jobs in the healthcare system. But I'm leading into this because there was also some great news that we received from a neurosurgeon at a consult this week for everybody sitting in this room. Mind you, it's a neurosurgeon that's giving this advice. He said, you don't have to exercise to lose weight. Quote, unquote. Everybody happy about that?
Okay.
Has anybody ever heard that any other place before?
No.
This comes out of a neurosurgeon office. And a little bit later, I'm going to be touching on judgment. And we're all subject to it. We're all subject to that judgment that we make on first glance. And I would suggest that the neurosurgeon was looking at weight right from the get-go, because he also said the only thing that impacts a person's weight is the calories we take in. That implies that medication doesn't cause weight gain. I tried to say something about chronic fight or flight response, which is developed from chronic pain, which creates problems, which can create problems with weight. I was cut off after my first word. From there on, I was all smiles. You know that plastic vial you see on somebody? Oh, yes, you're so very thorough. Just wanted to get out of there. So, bottom line was for this neurosurgeon is that my daughter's weight is the 100% cause of back pain and the disc herniation at L5S1. I'd like to be a mouse in a corner of that exam room when he's talking to somebody that's at the prescribed weight that has that same problem. How is he going to be able to tell that person that weight is the issue? Will they be treated any differently? Anyway, that was last week. Now I'm going to click through a bunch of slides that we've been through before. We talked about spending, how much we spend in America. We're almost double of the next country. We spend the highest percentage of our GDP. We're rated 37th by the World Health Organization in outcomes, or how the patients respond to treatment. We also took a look at the why it's important that we really honestly address this issue in America, because if we don't, that spending curve takes almost the entire gross domestic product. There'll be nothing left for anything else if we don't. The bottom line is the projected spending from Patient Protection and the Affordable Care Act, but what they're doing there is they are addressing spending. They're going to be cutting reimbursement, they're trying to gain some efficiencies, but a lot of it comes from taking money, increasing deductibles and co-pays for people, and spending less money on care. They're not addressing this picture, which the cost of medicine is exceeding the rate of inflation by almost double. So we're just kicking the can down the road by not addressing the problems, the underlying factors, and we went through some of those factors last week about what's driving that medical care index beyond inflation. And now I'm behind on my notes page. We also delved into briefly the relationships among various public policies. It's not just, there's other public policies that impact healthcare. The one thing I didn't say last week is the fact that many other countries in the world, when they go to change some of the policies that you see on the outside of that ring, they do what's known as a health impact study. In America, we don't look when we change those policies at how it's going to impact healthcare. I mean, we care enough about the environment that if we're going to do a building project, that we have to do an environmental impact study. But apparently, we don't care enough about people to be able to consider the impact on people's health care of our policies. Central to this, which I brought this slide up several times, I'll have to look in the mirror.
Sorry, you asked.
Yep. What do I believe? Why do I believe it? Because until we can sit there and justify to ourselves what we believe and why we believe it based upon good evidence, then we're not open to being involved in a conversation that may create challenges to our own established position or opinion. And there's a little bit of precedence in Scripture. This comes from the Sermon on the Mount. It deals with judgment. I mentioned that before. I think judgment on all of our parts. Yep. I'm human. I do the same thing. Thank God for Jesus Christ, because He's the one that covers that for us. And 81 million uninsured or underinsured Americans currently. With the Patient Protection and the Affordable Care Act, that'll probably come down to 30 million uninsured. You add the underinsured to it, that's best estimates, you're still going to stand somewhere around 50 million people that are either uninsured or underinsured. The system that we have, the complex system with all of the private health insurance companies, the studies that have been done, I use this one, It's 190 billion of excess administrative costs. Excess administrative costs. It suggests there might be a better way. A single payer system, and that doesn't necessarily mean socialized medicine. Socialized medicine is something like Great Britain, where all of the whole system is owned by the government. The doctors work for the government. The pharmacies are owned by the government. Single payer system is more like the Canadian system. All of the facilities are private, but the government is a single payer for all of those bills. In order to take a look at this problem, we not only have to look at ourselves, but we have to reframe the conversations. And basic to that, fundamental to that, is classifying healthcare as a basic human right, which we don't do in this country. By doing that, it'll change the framework on which the past 60 or 70 years worth of arguments about healthcare are made. Because the fundamental basis right now is that healthcare is a commodity that can be controlled by supply and demand economics. My opinion, current system is fatally flawed. It's not sustainable. We took a look at sustainability. Obamacare, insane reality. I'm not making a negative statement about Obamacare. I'm just making the statement that Obamacare still involves 100% of, a lot of the health care is delivered by private insurance companies, and the private sector over the past 60 or 70 years has failed in every attempt at being able to come through on the promises to be able to provide affordable health care to all the people in America. Einstein defined insanity as doing the same thing and expecting different results. We're still in that pattern. The one thing that we do have is we have a way to be able to judge it in about another 10 years, and that is the Commonwealth Fund scorecard, which compares the U.S. to a number of other countries. In another 10 years, you're going to be able to tell whether the policies coming online now are going to make it better or worse. But during that period of time, between 18,000 and 45,000 people are going to continue to die each year because of lack of access to health care. I have to say one last thing. I had the word genocide in the title. And what I'm referring to is, what is the future going to judge America on? How is history of America going to be written? Kurt and I talked about this one day, and I said, do those that are participating in genocide really understand that that's what they're doing? Probably not. It's a judgment made from the outside looking in, or it's a judgment made by historians writing about something 50 to 100 or 200 years later. So what will they write about America? We had this passage up last week, and to put a little context to it, there's some words in this that I'd like everybody to take home. The context was many of the religious leaders were using their position to make money, not necessarily sitting there preaching the truth. But the first italicized and bolded area, I think we're trapped in that cycle. You take a look at the way we treat each other, especially at the political level. You know, the civility with which conversations take place. I really think there's an unhealthy interest in controversy, and a lot of it comes down to, for the love of money.